Mark Drayford, thanks very, very much indeed for coming in and talking to us today. Much appreciated. Now then, the World Health Organization is coordinating much of the global response to the pandemic, though it's been attacked by President Trump, who this week called it China's Foreign Relations Agency. Maria van Kerkhove is the technical lead for the WHO on COVID-19, and I asked her about the likelihood of a second wave of infection hitting the countries that are already beginning to release their lockdowns.
It's certainly possible. What we're seeing in a number of countries that have been successful in suppressing transmission is that the virus that many more people remain susceptible. And what we're seeing in countries like Singapore, where they've seen almost like a second wave, essentially what it is actually outbreaks that are happening in expat dormitories. And so the virus has found a place where it can take hold and it can resurge again. So all countries must remain on alert for the possibility of additional transmission, even if they have been successful in suppressing transmission the first round.
Now, one question a lot of people have been asking themselves is to what extent masks are going to be useful in the process of unlocking.
So masks are very helpful in a number of situations, first and foremost for our healthcare workers. So that's the priority, and I think everybody agrees with that. We also recommend that people who are in the community who are feeling unwell, even if they're feeling a little bit unwell, to wear a mask. And the reason that that's important is because it's for source control. And what that means is somebody that may be infected with COVID-19, if they sneeze or if they cough, you still have to transmit the virus through respiratory droplets. That mask can protect the virus from moving from their mouth to someone else. So we do recommend the use of masks for people who are feeling unwell. But masks alone will not solve the problem. They cannot solve the problem. And especially if you're thinking about lockdowns and you're thinking of lifting lockdowns, there have to be a number of measures that have to be put in place before lockdowns can be released. And it must be done in a slow and a staggered approach.
Now, it seems that there's some evidence that the transmission of COVID-19 from children to adults is pretty rare. Does that mean that, for instance, unlocking schools relatively early in the process might be safer?
It appears that children seem to be less infected and less developing disease. From all of the countries where we've seen this virus, globally, children primarily develop mild disease, and that's really important. We have seen in some very controlled studies where you look at a household, for example, and you follow adults and children over time, that adults can infect children, and that's mostly what's happening is adults infecting children, but it can happen the other way around as well. So children remain susceptible, which means they can be infected, and it's possible for them to transmit, but it does seem rare. What we really need to understand is why. Why is this happening? Why do children seem to be relatively spared?
Now, one of the things that worried people was when they heard that people in South Korea had COVID-19 and recovered and then been reinfected. But it seems that's about false positives. So are you, to be clear, relatively sure that once you've had COVID-19, you can't get it again?
And what they're finding in some individuals, after they test negative, after a week or two or even longer, they're finding that they're testing positive again. And what is actually happening is as the lungs heal, there are parts of the lungs that are dead cells that are coming up that are testing. There's fragments of those lungs that are actually testing positive for PCR. It's not infectious virus. It's not reinfection. It's not reactivation. It's actually part of the healing process that is being captured again as being positive. So that's something that's really interesting. In terms of your question about can people be reinfected, that's a very important question. What we're learning right now is when somebody is infected with COVID-19, they develop antibodies and they develop part of an immune response 1 to 2 to 3 weeks after infection. What we're trying to understand is in that antibody response, does that mean that they have immunity? Does it mean they have a strong protection against reinfection? And if so, how long that protection lasts? We don't know the answer to that yet.
And are we any closer, do you think, in finding a drug that could treat coronavirus patients?
Every day we are getting closer and closer to finding therapeutics and a vaccine for COVID-19. The world has come together in solidarity to really look at this. There are hundreds of clinical trials that are currently underway for therapeutics, and we welcome all of these studies. We need to be careful when we look at individual results because we need to make sure that the studies that come out have a large enough sample size, that they're done in a very robust manner so that we can see which drugs work and which drugs are safe. And as soon as we have the answers to these, everybody will be aware of this. What's most important is not only having these therapeutics and the vaccines, it's ensuring that we have access, that the world has access to these therapeutics. They can't be developed in some countries and not be accessible to all.
A lot of people, of course, have now recovered from COVID-19. Are we learning anything about the longer-term health effects of this disease yet?
The majority of people who are infected with COVID-19 will make a full recovery. But there will be some people that may have some longer term effects. It affects the lungs, it affects the body in different ways. And so we may see some damage to the lungs. Again, we need to follow individuals over time. We're in our 4th month of this pandemic, so it's very, very early days.
Now, earlier this week, I'm sure you noticed that Donald Trump said there was evidence that COVID-19 had escaped from a laboratory in Wuhan in China. Then the intelligence services came out and said, no, that's not true. So what can you tell us about what you know about the origins of this disease?
Yeah, so coronaviruses normally circulate in animals, and many coronaviruses are circulating in bats. Most emerging pathogens, viruses, come from an animal reservoir. Everything that we have seen about the novel coronaviruses, COVID-19 or SARS-CoV-2, of the tens of thousands of sequences that are available, full genome sequences and partial sequences, compared to other coronavirus sequences that are available, this is of a natural origin. And it originally comes from bats because the coronaviruses come from bats. What we need to do is really understand what we call the intermediate host. What is the animal that was infected from bats that potentially infected humans? It's important that we know this because from a public health point of view, it's very important that we find the animal host so that we prevent this, we call spillover, from an animal, transmission from an animal to a human. We prevent that spillover from happening again.
And so what's your own feeling, your reaction, when you hear your President Donald Trump saying that the WHO is a public relations organization for China?
I can tell you that our teams have been working even before this virus was even identified on MERS, and now when this one came out, knowing that it's a novel coronavirus, to do everything that we can to inform our member states and all people all over the world about what this virus is.
Now, I know that you yourself have worked on Ebola and avian flus and other similar viruses. And we read that there are many more such viruses which could jump from animals to humans and infect us in the future. Given, I suppose you could say, that viruses have caught the world's attention at the moment, what more should we be doing as societies to protect ourselves against the next pandemic?
In my team and the teams that are working globally on high-threat respiratory pathogens, we were preparing for something like this because it's not a matter of if, it's a matter of when. And it's very important that we work with populations and people who are working at what we call the animal-human interface. So these are individuals that either work with wild animals or work with domesticated animals or who work in forests where they come in close contact. On the longer term, we need to invest in public health. We need to invest in people, in our public health systems across all of our countries to ensure that we have the fundamentals in place. People that can test, people that can do contact tracing, people that can care for sick individuals. All of that should be happening now. And making an investment in public health measures is good for everyone. If you're not using it for the next disease X, you're using it for influenza. You're using it for other diseases that are circulating in the countries, and it will help save lives.
Dr. Van Kerkhove, thanks very much indeed for talking to us. Fascinating. Thank you.
Thank you so much.